Good morning. At the outset, I thank Sages for this opportunity. I bring warm regards from my Department of Surgery, Government Medical College, Nagpur, India. So I'll be talking on two-dimensional versus three-dimensional laparoscopic colorectal surgery, a randomized control trial. So the Institutional Ethical Committee permission was taken. All authors declare to have no conflict of interest and there is no source of funding to declare here. So laparoscopic surgery is a revolution. It goes without saying. Three-dimensional HD cameras were created as an alternative to conventional 2D laparoscopy. Now, 3D technology is still not in vogue or in practice, maybe because of the initial side effects which for using the 3D vision system because of the poor image resolutions and of course the cost constraints. Now, with the advent of new generation 3D systems providing solutions to the current problems, we could seem to reduce the learning curve and improve the surgical precision. Now, aims of our study, the research question was, does use of 3D lap colorectal surgery make any difference in surgical outcomes compared to 2D lap colorectal surgery? Then to compare the surgical outcomes of 3D lap colorectal surgery with 2D lap colorectal surgery, the primary objective was to compare the operative time, blood loss, the dissection, and the suturing time in lap colorectal surgeries done by 2D versus 3D. Then to compare the occurrence of complications, rate of conversion to open surgery, and post-op complications. A randomized control trial over 3 years at a tertiary teaching hospital, that is Government Medical College, Nagpur. Patient selection done as per the inclusion and exclusion criteria. The enrolled patients were alternatively randomized after the detailed clinical, radiological, and pathological assessment. Then they were compared in terms of various intraoperative and postoperative parameters, the early post-op findings, patients, surgeon's factor, duration of hospital stay, post-op complications were assessed. It was RCT. The period was from October 2020 to September 23. It was done in our department. The patients admitted in wards at GMC with colorectal diseases, the sample size initially thought was 50 cases minimum. The procedures which were included, usually they require the mesorectal presacral dissection like anterior resection, abdominoperineal resection, and posterior rectopexy for prolapse rectum. So the early cases of histopathologically proven colorectal malignancies were included. Those with the downstage who took neoadjuvant chemoradiation, they were also included, and cases of early non-complicated rectal prolapse were included. The advanced metastatic cases, of course, were excluded, and the patients who were unfit for general anesthesia and non-consenting patients were excluded. Now, total 59 procedures were performed during that period. 29 with 2D and 30 with 3D group. The 3D group was associated with lower operative time as compared to 2D cases. Various parameters like duration of dissection, intraoperative blood loss, conversion to open was seen significantly less in 3D cases as compared to 2D cases. There was less need to conversion to open in 3D cases. No any adverse post-intraoperative events were noted in either. Complications, local and overall hospital stay was also assessed. The average duration of stay was less in 3D cases, maybe because of the lesser conversion rate to open. Now, duration of surgery was significant difference. Blood loss, intraoperative, maybe because of the ease of dissection was again significant. Suturing time, definitely ease of suturing is there with the 3D. Conversion to open, as I said, was significantly more with 2D cases. That in turn affected the hospital stay, and complications were almost similar. So the conclusion, the newer 3D vision systems seem to offer advantages over 2D system in terms of reduction in operating time, reduced suturing time, operative morbidity, post-op complications, hospital stay. These are the advances coming up, the surgical helmets with 3D incorporated cameras, ICG, as we all know, with the near infrared cameras, it's in vogue. Robotic 3D systems, of course, robotic is much in practice in colorectal surgery because of the 3D advantage. Augmented reality and virtual reality, these are the things for future. So thank you for the patient listening.